You called us about job cuts at Greene Memorial Hospital, and tonight we get answers for voters who wonder why a levy that was passed in November did not prevent people from losing their jobs. Anthony Kiko did some digging for you. He's live with the hospital's response.
Marcia, Kettering Health Network officials refused to say exactly how many employees are being laid off, but did say that the hospital would no longer offer inpatient psychiatric services, something that comes as a shock to some.
No.
They weren't upfront about it?
No, they were not upfront.
Sherry Newcomer has volunteered at Greene Memorial Hospital for 12 years. She says hospital officials encouraged her and other volunteers to advocate for the levy, but didn't tell them that even if it passed, cuts would be made.
We were asked to put signs in our yards. Being a volunteer here, we were asked, to support it as much as we could, tell our family and our friends. We trusted them, and this is what they're doing to us now.
In a statement, the Kettering Health Network told 2 News it wasn't clear that the cuts were needed until December, and the money generated from the levy only accounts for 4% of the hospital's operating costs.
I was surprised a little bit.
We caught up with Amy Schmidt during her afternoon jog. She voted for the levy, but says she understands why the cuts are being made.
Times are still tough, and budgets have to be looked at and re-looked at.
But Sherry says tough times don't make the cuts okay.
I just really feel they could have handled everything a little bit better.
Now, the Kettering Health Network also added that the new economic reality is that hospitals are required to care for more patients with less reimbursement. Sherry says she thinks that this is the beginning of the end for Greene Memorial Hospital. Reporting live, Anthony Kiko, 2 News on your side.